So the nose is a major gateway for mold into the body, that in the gut, and mycotoxins can affect the digestive system, even the pituitary system, the hormonal system, cognition and mood. So almost all my patients suffering from mold allergies have sinus infections. So I'm measuring if they have an allergy to mold or even an allergy to mycotoxins on the labs. And I'm also testing to see what infections they have in their sinuses. Usually they've got all of this going on. So if they've got mold in their sinuses, chances are they have mycotoxins there as well. That causes inflammation. So then inflammation in the sinuses can cause other issues like hormonal disruption. Mycotoxins can cross the blood-brain barrier. Excuse me. The olfactory nerve, it sits in our nose, it sits behind our sinuses, and it's linked directly to the brain, into the limbic system, which is made up of 3 parts. So the hypothalamus, the master regulatory center for hormones, it's where all the hormones are regulated, literally. I know you know this, obviously, but just for our audience. And then there's the amygdala that's there, the fight or flight center, which interacts with the adrenals, and the hippocampus, the memory center. So then if you have inflammation in your sinuses due to inflammatory cytokines from chronic infections in the sinuses or from toxins like mycotoxins, the toxins from mold, or people who live where we do in Colorado or California, wildfire particulate matter. That inflammation can travel up to the brain. I don't know if the particulate matter can, but I know the inflammation that it causes can. It can travel up to the brain by the olfactory nerve. And we get inflammation in the hypothalamus, where all the hormones are regulated. It can disrupt everything from menstrual cycles in women. We can get heavy menses or early menses or low testosterone in men. I see such low testosterone in my young men, actually. It can be due to inflammation of the hypothalamus. So the chronic sinus inflammation plays a huge role there. I think about the amygdala, right? The amygdala is inflamed. The person can get a lot of anxiety, fear, adrenal stress. And then the amygdala stimulates the hypothalamus. That stimulates the adrenals to dump adrenaline and cortisol. The person goes into fight or flight. We see it all the time. In fact, I think that a lot of the times when people have emotional issues or mental issues, I really correlate it with a lot of infections. And a lot of the times I think people come into the world, we all come into the world with our human condition. We all have 1 or 10 of those, right? But I find that mold illness and also other infections and toxins, the inflammation created by those things, toxins, infections, they cause neuroinflammation, and that can cause inflammation in the brain. So it's this picture of mold and other infections and toxins, which I find are really affecting people's brain and amplifying whatever maybe, I'm going to say, human condition we're wired with, whether we're wired with anxiety or maybe depression, or maybe some people are wired with a little bit more anger. These things, I think, get amplified by the infections.